Good morning, good afternoon, and good evening, everyone, wherever you're in the world. My name is Violetta, and I'm delighted to meet you, and I express my appreciation to the organizing committee of Third International Conference of Pharmacy and Health Sciences for the privilege to share results of scientific work titled Effects of coordination compounds of germanium on the levels of nicotinamide coenzymes in the tissues of experimental animals, which had been conducted in the Department of Pharmaceutical, Biological, and Toxicological Chemistry of Bogomolets National Medical University, Kyiv, Ukraine. Among the known metal complexes, much attention is focused on the study of coordination compounds of germanium, which have demonstrated their efficacy in oxygen deficiency, acute ischemia, heart and liver damage, endogenous and exogenous intoxication, close traumatic brain injury, etc. Objective for our research was to study and compare the effects of nicotinic acid, nicotinamide, and coordination compounds of germanium with nicotinic acid, MIGU1, and nicotinamide, MIGU2, on the synthesis of NAT coenzyme in vivo. The study was performed in Vistar rats, which were divided into 5 groups: injected with saline solution, nicotinic acid, nicotinamide, and coordination compounds of germanium, MIGU1 and MIGU2. The levels of NAG in the examined tissue differed in the following order: liver, brain, and heart. It was found that the administration of nicotinamide and MIGU2 increased the levels of NAG in all studied tissues compared to the control. However, it should be noted that the administration of nicotinic acid and its amide affected the levels of NAD more significantly than the studied coordination compounds of germanium. In the liver, the effects of MIGU1 was greater than that of MIGU2, while in the brain, the effects of MIGU2 was greater than that of MIGU1. In the heart muscles, the levels of NAD were the same after the administration of both MIGU1 and MIGU2. As a conclusion, we should say that the comparative analysis of the effects of nicotinic acid, nicotinamide, MIGU1 and MIGU2 on NAD synthesis suggests that, first, the pharmacodynamic and pharmacokinetic parameters of the studied coordination compounds of germanium differ from those of nicotinic acid and its amide. And secondly, pharmacological activity of MIGU1 and MIGU2 may be different from their use by the tissues in the synthesis of nicotinamide coenzymes. At the same time, despite promising use of germanium-containing compounds, further comprehensive studies of the pharmacological mechanism of action of each of them are still required. I want to acknowledge my co-authors, Professor Irina Nizhenkovskaya and Associate Professor Alina Kuznetsova, and thank you so much, University of Kuala Lumpur, for the opportunity to share results of our scientific work. Thank you for your attention.
This is Dr. Zit, present research article on the topic, Drug Utilization Review on Antimicrobial Agents in ENT Department. Introductions. Disease of the ear, nose, and throat affect the functioning of the adults as well as the children, often with a significant impairment of the daily life of the affected patients. And it has been envisaged that with increase in the global population, infections remain the most important cause of the disease, with upper respiratory tract infections causing the hearing loss and the learning disability, especially in children. And meteorology, it is a prospective cross-sectional study which was conducted in the Ajit Singh Hospital ENT Department, Bijinagara, Mandya, and it was a period. It was for a period of 3 months, and it was done usually for the assessment of the rationality of the administration of antimicrobial agents by using the modified Kunin criteria as the following. There are total 5 criteria: criteria 1, 2, 3, 4, 5. 1 means it says agree with use of therapy as given in the prescriptions, and the two criteria 2 means agree with the use of therapy, but potentially fatal infection cannot be ruled out. Criteria 3, agree with the use of therapy, but different combination of therapy is preferred, and that means which is preferred for usually the less expensive and the toxic medicines. And the criteria 4, it is agree with the use of therapy, but modified dose regimen and duration would be recommended. Disagree, this is criteria 5. Disagree with the use of therapy, and because administration is unjustified or unnecessary use of the drug. And the main objective is to examine the antimicrobial drug consumption pattern in the ENT department, and also assess the rational use of antimicrobials in the ENT department. Results: a total of 225 prescriptions were studied, where 51.5% were female, and the 48.4% were the male. Majority of the patients were belonging to the age group of 22 to 35 years. They are 35 years of age, followed by the age group 36.50 years, and the demographic details shown in the table 1. And the present study observed was the ear disease. The 88. That is 39.1% is the most common disease, followed by the throat disease 82, which is 36%, and the nose disease 13.7%. In case of the ear disease, the most common disease identified was acute otitis media 14.2%, followed by the ASM 11.1%. And in the throat disease, the most common disease identified was acute tonsillitis 23.9%, as well in the figure number 1. And in this study, the most commonly prescribed antibacterial were the beta-lactam 73.8%, followed by the aminoglycosides, which is 21%, and the ciprofloxacin clavulanic acid 36.5% was the most preferred antibiotics, followed by the amoxicillin clavulanic acid, which is 19.45%. Neomycins 20%, as shown in the figure number 2. Average number of the antimicrobial agents prescribed was 1.14 in patients with antimicrobial agents. Patient with the 1.14 patients. Then, as per the Kunin's modified criteria, 87.5% of the patients received the AMA antimicrobial agents therapy appropriately, and 12.4% of the patients received the antimicrobial agents therapy inappropriately. So, as I already discussed, it is shown in the table number 1, demographic details of the study patients. It is shown that the female patients were more in case than the male patients. And in case of the number list of antibiotics appropriateness based on the Kunin's modified criteria, appropriateness was seen in the 197 antibiotics, and inappropriate was seen in the total 28 antibiotics out of 225 antibiotics. And distribution of the final diagnosis in the patients, prevalence in the ENT disease. In first, number 1 is acute, that is 50%, acute otitis 59, ASM 36, acute 24, and it goes on like this. And the distribution of individual of the antibiotics percentage wise, it is kept, and most commonly used antibiotics was the ciprofloxacin clavulanic acid, which is 36.50%, followed by the amoxicillin clavulanic acid 19.45%, and so on. And lastly, this is the frequency of each antibiotics. In case of the discussions, it has been investigated that with an increase in the global population, infections remain the most important cause of the disease, and disease of the ear, nose, and throat are very common problems in the general population and cause impairment in the routine life. And our main aim is to analyze the developing trends of drug uses at various levels in the healthcare system. And the drug utilization review about the prescription pattern of antimicrobial agents had been in the outpatient department of ENT, which shows wide use of antibiotics. In this study, certain studies show that the male were more exposed to the ENT disease. The age group commonly affected was the 21 to 50 years of age. And 17 cases falling under the category 3 whereas they received more than one antimicrobial agents concomitantly, and 11 cases falling under the category 5 as the patients of the viral infections received the antimicrobials. And this was similar to the study conducted by the Desmok et al., where they reported 83% of the patients received the antimicrobial agents appropriately, and 17% patients received the antimicrobial agents inappropriately based on the Kunin's modified criteria. So, conclusions: the ENT infections are the clinical entities frequently seen in the children and adults, and the considerable morbidity, distress, and the early mortality. The incidence of the ENT infection is enormous due to the exposure to pathogens, environmental pollutions, and defects in the immune system. Physicians must be aware of the various pathogens and the resistant patterns in hospitals, and exercise good judgment in the selecting the drug regimen. Professor's pharmacy practice, Associate College of Pharmacy, completely interest no, and these are the references. Thank you.
Hi, this is Dr. Yogendra Shrestha. Today, I'm going to discuss the efficacy and safety of COVID vaccines available in India. The novel severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, which is responsible for coronavirus disease, has spread to 220 countries and has been found to be challenging. As of 26 July 2021, India, 31.4 million people suffered from these diseases, where 4.2 lakhs people lost their lives. Till now, 435.196 million people vaccinated with different vaccines available in India. The reproductions number, which is denoted by R0 of this virus, is very high. That is 2.24 to 3.58. If replications rate of virus is 1, it means one infected individuals can cross transmit to around 13,000 people within 60 days. Comparing with the Wuhan 1 references, that is the virus which is first detected in Wuhan, now the new viruses are having at least 10 mutation sites on average, and some of them are able to show false negative results in diagnostic tests and are seems to be more contagious than reference virus. Although scientific effort to develop focused medicines are ongoing, the symptomatic approaches to treat and prevention remains the best options. So to protect the healthcare system, reduce the death and disease control, DCGI approved 3 vaccines for restricted use in emergency situations in the India. Now, platforms of COVID-19 vaccines. There are 4 different platforms of COVID-19 vaccines. First one is virus vaccines. It can be available in 2 forms, that is live attenuated vaccines, where the disease-causing virus will grow under special laboratory conditions that cause it to lose its virulence or disease-causing properties. And another is inactivated vaccines, which is produced by killing the disease-causing virus with chemicals or heat. In nucleic acid vaccines, the genetic materials like DNA and RNA fragments are used to stimulate immune reactions. And in case of viral vector vaccines, the different viral vectors are used to introduce genetic sequence encoding antigen into the host cell. And another is the protein-based vaccines, where virus protein subunits are isolated and assembled into the virus-like particles using recombinant method, which can imitate the structures of viruses. According to the WHO, the efficacy of vaccines can be evaluated against infection severity and or seeding or transmissions, keeping as an endpoint. And those who can able to demonstrate around 50% point estimate can be acceptable as a COVID-19 vaccines. As per the FDA, laboratory verified SARS-CoV-2 infections is a good primary endpoint for vaccines efficacy trials, with a 50% chance of success in the placebo control trials. Here, in the head-to-head comparisons of vaccines available in India, we found that in the UK variants, all the 3 vaccines are equally effective, and in Indian variants also, all the 3 vaccines are equally effective. But in case of South African variants, AZD1332 is not effective, and the data from BBV152 is unknown, where COVID-vac is minimally effective. AZD1332, it can develop the myocardial infarction, cerebral venous thrombosis, and thrombocytopenia. And in BBV152, the hypotensions and anaphylaxis were reported. In case of comparisons of price, we found that AZD1332 is least expensive than other 2. There is no clear endpoint to measure efficacy of the vaccines, because different studies use various endpoints. The epidemiological study with the huge number of populations may predict the perfect endpoint for efficacy measurement until we can use the vaccine's ability to prevent infections, disease, hospital admission, intensive care unit admissions, death, and the transmission of the disease as the endpoint for the efficacy measurement. In the conclusions, we concluded that GAM COVID vaccine is designed as per the interest by using two different viral vector to induce neutralizing antibody, having wide range of coverage, which has shown comparatively greater efficacy and overall has not associated with this serious adverse event. Further study may be required considering the new variants.
Thank you.
Scheme in the Mandya district in Karnataka. Good evening. Myself Renuka Radhachetti, PhD research scholar, Adichunchanagiri University, Karnataka, India. My title: Study on Patient Rights, Patient Safety, and Utilization of National Health Scheme, Rural Mandya District, Karnataka, in India. Content of presentation: introduction, objective, result and discussion, conclusion, reference. In introduction, in NRHM, health is an important component of any strategy, economic health for all. For many years, our government committed that recognized the important role health improving quality of life citizen. Government of India launched a National Rural Health Mission, NRHM 2005, in the relieve health for rural people. Patient rights background: since the introduction, human rights to in this particular, the patient rights essential part of quality improvement efforts in health services. Patient safety is developing healthcare patient safety in this patient complaints, unsafe patient care, medical error, adverse events still prevent the most healthcare system and risk patient harm complications return to the in this to patient related complications annually, healthcare budget in billions. In my objectives, the assess the utilization of National Rural Health Mission, Mandya District, rural parts of Mandya District, and secondary objectives to know the patient rights among the participants, the study participants of patient safety perception of healthcare providers in this result and discussion. The 100 participants are the only 89 participants are completed NRHM awareness questionnaire as per guidelines, where 50 were the male, 39 were the female. The study we found that 77.5% and 69 participants are adequate aware. Participants were inadequate aware. 2.2% of participants are not sure about NRHM scheme. For patient rights awareness assessment, for the 100 participants and 83 participants are completed patient rights questionnaire as per the requirement. 45 and 54.21% of male, 45% 79 were female. Found that 75.5% are agreed, 7.5 disagree, 17% were not sure about the patient in the patient rights, about the patient rights. Similarly, for patient safety, 100 participants are the only 55 participants are completed a requirement. 21 were the male, 34 were the female. Out of 55 patients, 7.16 strongly disagree, 7.52% were disagree, and 8.92 were neutral, 37.52% were agree, 38.88% were strongly agree with the patient safety questionnaire enlist 5-point Rickett scale. Consistency between NRHM, patient rights between NRHM, patient safety, measuring use Crown Broach alpha was found to be internal consistent. There is no significant difference in awareness between NRHM and patient rights. P-value 0.019, and similarly, they also no significantly different awareness between NRHM and patient safety. P is 0.02. awareness NRHM scheme, lack of awareness 2.2%, inadequate awareness 20.2%, adequate awareness 77.5%, and a total in this 89 to 100% of this awareness of patient rights, agree 75%, 5%, disagree 7.50%, not sure 17%, and awareness of patient safety 71.6%, 5.52 disagree, and agree 37.52%, agree, strongly agree 38.88%. The conclusion, the people residing in rural Mandya district were about different service under NRHM, 77.5% which mandatory for achievement was an NRHM to provide the affordable quality care rural population, especially in this group, study vital patient rights, perception, standard, patient safety were fairly good present rural health care hospital, hence addressing the country's approach the existing in this total what's promoting long-term perspective and this exclusive rural health care currently need the total in this include conclusions. And this discussion regarding the data collection through the Google Meet for the proof of data collection in this reference. This thank you.
Hello to all. In this study, we have explored the effect of calpain inhibitor A6185 in Alzheimer's disease that is induced by amyloid beta 25 to 35 in mice. Introduction: Alzheimer's disease is characterized by the extracellular amyloid plaques deposition and tau tangle formation. Calpain is a cysteine protease that is calcium dependent and is activated by NMDA. Calpain activates CDK5 and generates P25 fragment that causes tau hyperphosphorylation. Previously, calpastatin has shown to reduce amyloid plaque and tau phosphorylation in transgenic APP or PS1 mice. This study is used to check the activity of calpain inhibitor A6185. Results: time spent in target quadrant using Morris-Water maze that is used to check spatial learning and memory. The mice is placed in water and checks and finds the platform. The time spent by the sham group to find the platform in the target quadrant is the maximum, whereas beta amyloid group spends the less time in the target quadrant, while the calpain inhibitor increases the time spent in the target quadrant dose dependently. Escape latency is when the animal escapes to find the platform. So the time spent on day 1 is the same for all the groups, while on day 4, beta amyloid group takes the maximum time to reach the platform, whereas the calpain inhibitor groups take the less time to reach the platform. Then learning and memory in step-down test by amyloid beta 25 to 35. The current is applied on the white platform, and on the black platform the animals are placed. The time taken by the beta amyloid group to step on the white platform is very less, 145 seconds, whereas the calpain inhibitor along with the amyloid beta takes much more time to step on the platform where the current is applied. The number of errors are maximum with beta amyloid group, whereas they are decreased with the calpain inhibitor. Step down percentage is decreased with the calpain inhibitors. Acetylcholinesterase activity. The acetylcholine esterase breaks down acetylcholine, and the acetylcholinesterase activity is increased in AD brains as seen with the beta amyloid group, whereas the calpain inhibitor decreases acetylcholinesterase activity and increases acetylcholine in the AD brain. Then acetylcholine Thiobarbituric acid rectus species are increased in AD brain due to oxidative stress as seen with the beta amyloid group. However, the calpain inhibitor restores the T-bars level in the AD brain. Glutathione is a antioxidant whose levels are decreased in the AD brain as seen with the beta amyloid group. However, the calpain inhibitor restores the glutathione levels in the AD brain. Brain catalase levels. The catalase levels are decreased in the AD brain as it is an antioxidant. As seen with the beta amyloid group, the catalase levels are decreased while it is increased or restored with the calpain inhibitors dose dependently. So, all in all, A6185 reduced the cognitive deficits in Morris Watermass and step down test, and also the oxidative stress parameters were decreased by calpain inhibitors. So, the calpain inhibitors decrease the calcium levels and prevent cell death, therefore, reduce cognitive deficits and reduced oxidative stress. So, thank you for watching. Have a great day.
Assalamualaikum and good day. I'm Nur Amalina binti Zainun, pharmacist from Hospital Tunku Fauzia, will be presenting a study entitled Retrospective Analysis of Respiratory Medication Therapy Adherence Clinic RMTech in the Management of Pediatric Bronchial Asthma. And here are the list of common abbreviations that will be used throughout this presentation. In most healthcare settings, pharmacists and physicians often do not readily communicate because they work independently and in parallel rather than collaboratively. Hence, Pediatric Respiratory Medication Therapy Adherence Clinic (PRMTAC) serve as an excellent platform for patient-centered care. In Malaysia, not all hospitals provide PRMTAC service. Hence, this study focuses on the roles of PRMTAC to complement clinical pediatrics management of bronchial asthma on the provision of clinical assessment, counseling, and monitoring. Moving on to the methodology, the study design of this study was a cross-sectional retrospective cohort analysis. The samples obtained were from 1st January 2019 until 31st December 2020. The sampling method used for PRMTAC records and medical pediatric records were purposive sampling and convenience sampling respectively. The targeted population in this study included pediatric bronchial asthma patients in Hospital Tunku Fauzia. Next is the results obtained from this study. There was a total of 87 medical records retrieved for the study, 47 patient records with ongoing PRMTAC service, while another 40 records were of medical outpatient pediatric bronchial asthma without PRMTAC service. This table describes the distribution of assessment of adherence and MDI technique during routine follow-up visits. There was a significant difference in the conduct of assessment for MDI technique between patients who underwent PRMTAC and patients who didn't. From the table, it was evident that those who underwent PRMTAC had been regularly assessed for MDI technique as compared to those who only had outpatient follow-up with medical pediatric teams. There was no significant difference with regards to assessment of prophylactic adherence. The study also performed logistic regression to determine significant factors associated with good asthma control by the last clinic visit of the year. The results indicate that an increase in age by every 1 year had 1.2 times higher odds for good asthma control. The results showed that good inhaler technique and PRMTAC status were predictive of good asthma control at the final clinic visit. Patients with correct inhaler technique were 6 times more likely to attain good asthma control as compared to patients with poor technique. Multivariate analysis demonstrated that good inhaler technique is the only factor significantly associated with good asthma control after adjusting for age, adherence, and the presence of PRMTAC service. Detailed assessment throughout a year-long follow-up visits between patients undergoing PRMTAC versus no PRMTAC were performed. The study determined that the comparative score for the assessment of interval symptoms and counseling was significantly lower for patients who were not subjected to PRMTAC service. PRMTAC service is a significant aid to the outpatient management of pediatric bronchial asthma. Specific criteria need to be fulfilled when assessing patients with bronchial asthma. The study found that these clinical assessments were inadequately assessed by the medical pediatric team during routine outpatient appointments as compared to the more inclusive assessment carried out by PRMTAC service. Next, lack of proper assessment of adherence and inhaler technique, particularly among non-PRMTAC patients, may result in poor technique and inadequate therapeutic relief. A study by Tanimalai in 2018 found that the odds of good asthma control was 3 times more likely with pharmacist intervention than without. Therefore, this highlights the important role played by parental service in the monitoring, counseling, and assessment of pediatric bronchial asthma. In addition, good inhaler technique, older age, and parental status were predictive of good asthma control at the final clinic visit. Patients with correct inhaler technique were 6 times more likely to attain good asthma control as compared to patients with poor technique. The result was well supported by a study done by Kapanoglu in 2015 that assessed the effect of correct inhaler use and adherence on asthma control was better among correct users. However, good inhaler technique is the only factor significantly associated with good asthma control after adjusting for age, adherence, and the presence of parental service. This finding was supported by a study among 330 Egyptian asthmatic children aged 2 to 12 years old that found better asthma control to be significantly observed among patients with correct inhalation technique. To conclude, parental service is essential in the outpatient management of pediatric bronchial asthma, particularly among those with partially controlled and poorly controlled illness. We strongly advocate that healthcare providers to move beyond task-based work towards a more collaborative approach and support interprofessional shared decision-making to improve patient care. Here are the list of references for this presentation. Thank you.
This is a study on preventive measures towards COVID-19 among the public in Malaysia. So COVID-19 is a global pandemic caused by the coronavirus, and it was first detected in Wuhan, China in late 2019. It causes flu-like illness, and in major cases can cause respiratory illness. Around the world, it has caused more than 180 million cases, as well as more than 4 million deaths. So in Malaysia, the cases have been rising since last year. Preventive measures have become the mainstay of COVID-19 management, which includes wearing a face mask, physical distancing, and hand hygiene. Very recently this year, vaccines have also become available. But because there's been a continuous increase in the number of cases on a daily basis, we want to see how well the public actually adheres to these preventative measures. This is the aim of my study, to identify COVID-19 preventive measures practiced among the public, looking into mask wearing, physical distancing, hand hygiene, and vaccine hesitancy. This was a questionnaire-based study which was distributed online via Facebook, WhatsApp, as well as email. Results and discussion. The socio-demographic characteristics of the respondents showed that majority were female and most were Malay, which was in line with the Malaysian population. As you can see, 89.3% of respondents said that they always wore a mask when they were out and about. There were some complaints when wearing a mask, such as difficulty breathing, facial skin irritation, acne and headache, and these could be among reasons for possible non-compliance. There was an association between demographics and mask wearing. Previous work has shown slightly different results. In this particular work, younger male respondents were less likely to wear a mask than older respondents. We also asked about cloth masks that were often used, but we found that very few understood the strict requirements of using an effective non-medical grade mask. So in terms of physical distancing, the public in Malaysia showed that 43% did not comply to physical distancing, but this was a lot better than what was found in other work, which showed a higher percentage of 92% and 46% that did not adhere to physical distancing requirements. Next, we looked at hand hygiene, and we found that about 47.9% said they always comply to hand hygiene, and this was similar to what was reported in previous work. Vaccines hesitancy was very important for us to look into. 67% of the study population said that yes, they wanted to take the vaccine, and it was shown that with a higher public confidence score, they were more likely to agree to vaccination. In terms of vaccine hesitancy, those that accepted the COVID-19 vaccines had a lower hesitancy level compared to those that did not accept the COVID-19 vaccine. And those that had a history of H1N1 vaccinations were more likely to accept the COVID-19 vaccines as well. So this was something that was similar to previously reported. In conclusion, although we performed the study a year into the pandemic, there was poor management of preventive measures. It is quite possible that the public has SOP fatigue, so the healthcare professionals may need to highlight strategies that include compassionate attitudes, as well as continuous education and assessment. We also need to look into vaccine safety to promote vaccine effectiveness and ensure herd immunity is reached as soon as possible. Therefore, until we reach herd immunity, preventive measures such as mask wearing, hand hygiene, physical distancing must still remain in place. So with that, I thank you. And these are my references.
Assalamualaikum and a very good day. I'm Noraida from Faculty of Pharmacy at UKM, and today I would like to share with all of you research titled Caregiver Self-Efficacy, Diabetes Management and Glycemic Control Among Children with Type 1 Diabetes. As an introduction, self-efficacy had been studied in adolescents and adults with type 1 diabetes, and results showed that higher self-efficacy had been linked with better adherence to treatment and better health outcomes. Adherence to diabetes management in children is difficult due to socio-emotional and cognitive immaturity and the need for caregivers' involvement. There are studies also which show inconsistencies in the demography and diabetes-related characteristics in predicting glycemic control. Hence the reasons why we wanted to conduct this study with the overall objective to investigate caregiver self-efficacy, diabetes management, and its association with glycemic control. And the following are the specific objectives. Next is on the methods. We utilize a cross-sectional observational study design with universal sampling. The population were caregivers of children with type 1 diabetes, fulfilling the following inclusion-exclusion criteria, and we had 2 study sites, which were the UKMMC and Hospital Tunku Aziza. The study duration was from March until April 2020. We used a questionnaire which consisted of 4 sections, and section B had the parental self-efficacy scale for diabetes management, and section C, the diabetes management questionnaire. Moving on to the results and discussion, we managed to survey 50 caregivers, and I would like to draw your attention to the following interesting finding, where we found that more than 3/4 of the children manage diabetes themselves with caregiver supervision, implying that children take charge of their own diabetes management. Next, for table 2, this shows the total mean scores of self-efficacy and diabetes management adherence of the caregivers. Overall, caregivers reported relatively moderate levels of self-efficacy and diabetes management adherence in relation to their child's type 1 diabetes. This reflects a relatively good confidence in the management of type 1 diabetes in children among the parents. In this study, overall glycemic control was found to be suboptimal with a median A1C of 8.5%, and less than a quarter of the patients actually achieved a target A1C of less than 7.5%. These results are actually similar to that reported in Malaysian diabetes in children and adolescents registry, or the DCARE report 2006-2008. Moving on to the next results, table 3 shows the correlation between caregivers' self-efficacy, diabetes management adherence scores, and glycemic control. Modest negative relationship was found between caregivers' self-efficacy and diabetes management adherence with the A1C. Higher self-efficacy and diabetes management adherence results in lower A1C, implying a positive diabetes outcome. Studies on the relationship between diabetes management and glycemic control in youth have been actually inconsistent. Next, table 4. This represents the multiple linear regression analysis in determining the factors associated with good glycemic control. So prior to performing this stepwise linear regression, we investigated association between demographic data and diabetes-related characteristics with glycemic control. Those found to be significant were incorporated into the stepwise multiple regression analysis. The analysis demonstrated that higher diabetes management scores and shorter duration of diabetes was significantly associated with better glycemic control, as reflected in the following equation. This indicates that for 1 unit increase in the DMQ score would reduce the A1C by 0.348, and an increase in duration of type 1 diabetes by 1 year would increase the A1C by 0.269. So this is also been reported in other studies in relation to the deterioration of A1C with longer diabetes duration. As a conclusion, we can see that from this study, the glycemic control remains suboptimal. The moderate level of caregiver self-efficacy and diabetes management being shown in this study. The factors significantly associated with poor glycemic control were the longer diabetes duration and lower diabetes management adherence. So when we do counseling, we should focus on these two aspects. So we need to counsel parents or caregivers on the importance of diabetes management adherence, and perhaps our focus could be on those children with longer duration of diabetes. That's all from me, and with that, thank you very much.
Hi, I'm Hui, and I would like to present my topic, Knowledge and Awareness of Pilates in Breast Cancer Rehabilitations among the Malaysian physiotherapists. And breast cancer is actually the most prevalent cancer in Malaysia among women nowadays, and actually majority of them, they didn't go for a routine check for their breast or defects or go for annual screening after the age of 40. And despite improved survival levels reported by the women diagnosed with breast cancer, there's a lot of side effects and eventually contributes to the impairment in their quality of life and related to the health. So actually now Pilates exercise developed by the Johnson Pilates has been used as a part of orthopedic injury rehabilitation service nowadays. So for the need for the study, the rehabilitations of the breast cancer treatment using Pilates exercise, especially targeting the upper extremity functions, show more beneficial effects such as range of motion compared to the home exercise program. And there's a lot of lack of breast cancer awareness and knowledge and a lot of myths about the etiology risk factors and breast cancer management nowadays. So a few Malaysian rehab Pilates instructors also stated that there's a lack of awareness and knowledge of the clinical Pilates in current situation and would like to work on increasing the awareness. So for my research question will be, what is the level of knowledge and awareness of the Pilates in breast cancer rehabilitation among the Malaysian physiotherapists? And my objective will be to determine the level of knowledge and awareness of Pilates in breast cancer rehabilitation among the Malaysian physiotherapists. So for my study design, it's a self-administered questionnaire using the Google Forms, and will distribute through the Facebook groups and also emails to the private centers in the Malaysia, including all 13 states. And my sample size is into the 113 physiotherapists located in Malaysia. So for my inclusion criteria for the participants is included certified Malaysian physiotherapists with working experience for more than 1 year, under diploma, degree, master or PhD graduate, and able to speak and read and understand English. And exclusion criteria include the physiotherapists who doing other career than treating patients, certified physiotherapists who not practicing profession for the past 5 years. So for my statistical analysis was performed using SPSS software version 16, descriptive statistics with frequencies and percentage were obtained for all the variables in the study. So for my research procedure, of course, it will start from the submission of the proposal and obtain the ethical clearance, create and validate the questionnaire, recruitment of the participant and obtain the informed consent from the participant, then screening inclusion and exclusion criteria, and explain my study procedure to the participants, and distribute all my questionnaire to them, and started to data collect and data analysis in the SPSS software. So for the first table result can show that the knowledge about the risk factors and the breast cancer has shown that almost 95% of the participants link their breast cancer to the genetics or family history, and that more than half participants assume that increasing age, stress, smoking are one of the risk factors of the breast cancer. But I know most of them believe that working class women and large breasts are not related to the breast cancer. And next, about the knowledge about signs and symptoms of the breast cancer. Large number of the participants identifies that lump in the armpit, discharge from the breast, pain and soreness in the breast, changes in the shape of the breast, lymphedema are identified as the signs and symptoms of the breast cancer, while the others minorities of them identified as a sign or symptom. So with the gender and awareness of the Pilates shows that 68% of the female aware of Pilates, while only 27 of them only male aware. This indicates that female physiotherapists are more aware of the Pilates in the breast cancer rehabilitation than the male. So as you can see that when we ask the reason that they are very interested in Pilates, actually there are a lot of Malaysian physiotherapists are eager to gain more knowledge and application of the new techniques. While the others that are not interested in Pilates are actually found out they're not familiar with the Pilates related to the woman's health, and also there's a low awareness among the physiotherapists regarding the Pilates in helping breast cancer patients. And lastly, many of them strongly agreed Pilates should be enforced to be performed in hospital or clinic, and also interested in pursuing future Pilates workshops. So first discuss about the knowledge of the risk factors of breast cancer. Current studies show that most of the participants have low to moderate understanding on risk factors of breast cancer. Actually, it's in line with previous study. Most of the participants recognize genetic or family history as a risk factor, according to the Paul research. And actually, only 25 of the interviewees in previous study identified growing age as a risk factors for breast cancer in Australia, under the research of Kuala. And that's the knowledge of the breast cancer symptoms in current study. Most of the participants stated that the lumps in the armpit is the most common signs and symptoms in the breast cancer. It's in line with the previous findings in Singapore, probable breast lumps and discharge of the nipples as the most common symptoms under the usage of skin. In contrast, the misconceptions that lumps in the cancerous brain are painful, shared by the Universiti students in Angola. And lastly, the discussion on the awareness of Pilates. For the current study, majority of the participants are unaware that breast cancer musculoskeletal problems can be treated using Pilates. For the previous study, many doctors and therapists are usually unaware of the technique due to the notice of the absence of the studies specific to the Pilates training, and also only a few Pilates-specific clinical trials reported and mentioned in the Midlands as well. So for the limitation of this study is the proportion of the return is low due to the pandemic period. Among the period is the fact the attractiveness of the questionnaire, the care of the filling out of the questionnaire, and also the inducement of the completing of the questionnaire. The sample size in this study is still in favor in Selangor State because of the relatively smaller number of physiotherapy centers in the other states. In conclusion, clinical Pilates instructors are strongly encouraged to increase awareness and knowledge of Pilates on the benefit and successful outcomes to the physiotherapist field. The role of the social media and journals actually should be emphasized, as it has been found to play a key role in imparting health education, delivering beliefs, and growing the public popularities of the Pilates. Studies with larger sample size are strongly recommended as well to ensure that the accuracy of the present study, which will help to advance and the appetite and knowledge of the physiotherapist. And all this is my references, and thank you very much.
Hi everyone, I am Dr. Saravanan Jagadisan, and I'll be presenting the study on Centella asiatica and how it attenuates hippocampal injury in chronic stress-induced Wistar rats. I would like to acknowledge both UPM and UTAR. Stress is an emotional response to an external stimuli or a situation, which could be a job loss, financial situation, marital discord, or stress at workplace. When stress becomes prolonged, it's called as chronic stress. Chronic stress affects many systems in the body, with the brain and endocrine system being more vulnerable. This is mostly because of the excessive glucocorticoids secreted by the endocrine system. The outcome of chronic stress is depression. We need to worry about depression because it has already affected 250 million people worldwide, and it has pushed Asia to the second position. The pharmacological treatment for depression has its own limitations, particularly slow onset of action, hepatotoxicity, and fetal anomalies when administered during pregnancy. All these factors put together, it leads to non-compliance of medication. Centella asiatica has been used in Ayurvedic medicine and traditional medicinal practice in Malaysia as a neuroprotective agent, and it was also called as a neurotonic. Saponins are the major neuroprotective component of Centella asiatica. For our study, we procured a standardized ethanolic extract from UITM. Malaysia stands to benefit from Centella asiatica because of its fertile soil, climate all around here, and people's attitude towards the herbal products. For this study, 36 male Wistar rats were procured and maintained under laboratory conditions and were grouped into 6 groups. The first one was the control, the second one model group, third one was the fluoxetine group administered at 10 mg per kg body weight, and the other 3 groups were given 200, 400 and 800 mg per kg body weight of Centella asiatica extract. The stress was given to these animals except the control group. All other groups received the stressors. 2 stressors were given randomly every day for 64 days. At the end of 64 days, the animals were euthanized. Blood was collected to estimate the cortisol levels, and the brain tissue was collected for nasal staining. The cortisol levels were estimated using ELISA technique. The model group showed increase in the cortisol levels, while the fluoxetine Central Asiatica 400 and 800 groups showed reduction in the cortisol levels. The Nissl stain is widely used for observing neurons and also for scoring the viable neurons in the brain. While observing the results of CA1 region of the hippocampus, we can see the model group has less densely arranged neurons, while that of the fluoxetine, CA400 and CA800 have densely packed neurons. Now, when the scoring was done, we observed the control, the fluoxetine, CA400 and 800, all of them had more viable neurons than the model group. In the CA2 region of the hippocampus 2, we had a similar result for fluoxetine, CA400 and CA800, both in imaging as well as in scoring for viable neurons. The CA3 region of the hippocampus 2 showed similar results with more viable cells present for fluoxetine, CA400 and CA800 mg per kg body weight. The results of the Nissl stain can be seen in this chart. To summarize, chronic stress induces depression, and Central Asiatica has shown promising results with a similar efficacy to that of fluoxetine. I would like to conclude by saying that Central Asiatica, with its very low toxicity, could be an alternative to the current antidepressant medications available. These are the references. So that's the end of the presentation. Thank you very much.